Hello, dear colleagues. My name is Dmytro Chumachenko, and I'm glad to present the results of our research, the framework of estimation of the impact of the Russian war on the infectious disease spreading. Infectious diseases continue to significantly threaten public health, causing millions of deaths and illnesses worldwide each year. Despite advances in medicine and technology, the emergence and spread of the new infectious diseases and re-emergence of previously controlled diseases continue to challenge healthcare system and economics globally. This persistent problem underscores the need for continued research and development of effective strategies for controlling infectious diseases. One of the recent most significant infectious disease outbreaks is COVID-19 pandemic caused by the novel coronavirus SARS-CoV-2. Since its emergence in late 2019, COVID-19 has rapidly spread to virtually every country worldwide, leading to a massive global health crisis. The pandemic has highlighted the urgent need for effective prevention and control measures and has exposed weaknesses in the healthcare system worldwide. As such, COVID-19 has spurred a surge of research efforts to develop strategies to combat infectious diseases. On 24th of February 2022, Russia launched a full-scale invasion of Ukraine, and in addition to tens of thousands of deaths and injuries, the escalation of the Russian war in Ukraine has also brought a massive humanitarian crisis that has affected public health. So the study aims to develop a framework for assessing the impact of the Russian war in Ukraine on the dynamics of the spread of infectious diseases. So we propose a methodology for assessing the impact of Russian war in Ukraine on the dynamics of epidemic processes. And for this, we propose the following steps. Firstly, to develop a machine learning model of the epidemic process to predict the dynamics of morbidity and mortality from an infectious disease in a selected area. Second step is to verify the model by assessing the accuracy of the retrospective forecast of mortality and morbidity from an infectious disease in the selected area from January 25th, 2022 to 23rd of February 2022 for 30 days before the beginning of the escalation of the Russian war in Ukraine. The third step is to calculate the predicted morbidity and mortality from an infectious disease in the selected territory from 24th of February till 25th of March for 30 days after the beginning of the escalation of the Russian war in Ukraine. The next step is to calculate the deviation of actual morbidity and mortality from an infectious disease in the selected area from the constructed forecast. Then to assess the factors influencing the epidemic process depending on the infectious disease, the nature of its distribution in the selected territory. And the last one is based on the simulation results to identify public health risks and necessary measures to control the spread of infectious diseases. The framework for assessing the impact of the Russian war in Ukraine on the dynamics of epidemic processes of infectious diseases is shown on the slide. For the experimental study, we used polynomial regression model. Polynomial regression is a regression analysis in which the relationship between the independent variable, in our case time, and the dependent variable, the forecasted variable, is modeled as an nth degree polynomial function. Polynomial regression aims to find the best fitting curve that passes through the data points. I wouldn't stop on that in more detail because it's a well-known method actually. So a machine learning model based on polynomial regression methods was applied to estimate the impact of the Russian war in Ukraine on the dynamics of COVID-19 epidemic process in Ukraine, and the model was implemented in Python programming language. To verify the model, we built a retrospective forecast of morbidity and mortality from COVID-19 in Ukraine from 25th of January 2022 till 23rd of February 2022. As you can see on the table on the slide, model accuracy rates for cumulative new cases and deaths for COVID-19 in Ukraine for that sample, and it's quite high accuracy. To evaluate the impact of the Russian war in Ukraine on the COVID-19 epidemic process dynamics in Ukraine, we have applied the developed model to the data sample from 24th of February till 25th of March 2022, and you can see our results on the table on the next slide. And as you can see, the accuracy is really low, and the model is not applicable to that sample. So the next slide shows the deviation of daily reported new cases of COVID-19 in Ukraine from the predicted values for the period for the first 30 days of the escalation of the Russian war in Ukraine. On the left graph, you can see new cases, and on the right, it's fatal cases. So Russia's military intervention in Ukraine in February 2022 has resulted in a humanitarian crisis and has exacerbated the COVID-19 situation in the country. The war has made it difficult to identify, diagnose, and register COVID-19 cases, and hospitalization of severely ill patients is limited due to the overcrowding of hospitals with wounded military and civilians. The electronic system for recording COVID-19 incidents is also limited, leading to a significant decrease in reported cases compared to real ones. Anti-epidemic measures such as social distancing and mask wearing are not observed due to the introduction of martial law and the need for people to hide from artillery and airstrikes in the bomb shelters and basements. The vaccination campaign against COVID-19 in Ukraine began on 24th of February 2021, so it's exactly 1 year before the Russian war in Ukraine escalated. Only 36.93% of the population had been vaccinated with 2 doses. However, vaccination has been completely stopped and temporarily occupied by Russia territories of Ukraine and territories where active hostilities are taking place. The chaos of war and accompanying psychological factors have also forced the problem of infectious diseases out of people's mind. The pandemic is no longer the top priority of Ukraine healthcare system. The Russian war in Ukraine is a crucial factor in the new infectious disease outbreaks and exacerbates the country's humanitarian catastrophe caused by Russia's military intervention. This situation highlights the importance of ensuring access to medical facilities and supplies, maintaining and improving public health infrastructure, and ensuring the humanitarian crises are not ignored during the war. The framework we propose in this study for assessing the impact of the Russian war in Ukraine on the dynamics of the epidemic process of infectious diseases makes it possible to identify changes like spread of morbidity and introduce timely control measures. The results obtained from the simulation have highlighted several problems that exist in the healthcare system. These results provide valuable lessons that can be used to improve the functioning of healthcare systems during extreme situations, including times of war. Mathematical modeling is essential for assessing the dynamics of the epidemic processes and understanding the factors that influence the spread of the disease. Doing this makes it possible to make timely adjustments to the structure and scope of preventive and anti-epidemic measures that can help prevent the spread of the disease. When epidemiological surveillance and response systems weakened and conditions worsen, mathematical modeling and adequate models can help minimize the consequences of any disruption in the public health system. They can also help adjust the activities of relevant services and reduce the burden on the healthcare system caused by growing incidence, disease severity, and mortality. Thank you for your attention. I'm ready to answer a question, and we are ready to collaborate during our further researches. Thank you.